Hi, I'm Erin Power.
And I'm Laura Rupsis.
We're certified health coaches, and this is Health Coach Radio.
This podcast is about the art, science, and business of health coaching.
We share our insider tips to help you become a better coach and entrepreneur.
And we interview expert guests to discover how they've made it in this growing field.
It's time for health coaches to make an impact.
It's time for Health Coach Radio.
Today's guest is Dr. Carolyn Ross, an MD board certified in preventive medicine and addiction medicine who works with women with eating disorders, body dysmorphia, and who struggle with emotional eating triggered often by early childhood experiences and trauma. And it was a really important and impactful conversation. So much so that I don't know that a lengthy podcast intro will do it justice. I encourage you to pay close attention to what Dr. Ross teaches and then go down as many rabbit holes as you can to really understand this stuff. I know I have. If you work in the weight loss space specifically, it's time to start expanding what we know about excess body fat, body size, why we're resistant to letting go of body fat, and more. And folks, it's really not just macros and meal plans. We'd love to see who's listening out there, so take a screen grab of your podcast player and tag us on Instagram at Health Coach Radio. By the way, you can find the show notes for this episode and all previous episodes at primalhealthcoach.com/radio. Here at Health Coach Radio, we're all about raising the voices of practicing health, fitness, and nutrition coaches and helping to drive our exploding industry forward. Our show is proudly brought to you by Primal Health Coach Institute, an approved educational provider with the National Board of Health and Wellness Coaches, which means that our graduates can become eligible to sit for the NBHWC credentialing exam to become a board-certified health and wellness coach. Our fall semester is off and running, and we're currently enrolling students for our spring 2022 cohort, which starts in February. You can learn more at primalhealthcoach.com/level2. With that out of the way, it's time to get into this powerful and eye-opening conversation with our guest, Dr. Carolyn Ross.
Hello, Dr. Carolyn. We're so excited to have you with us today. How are you?
I'm good. It's great to be with you, Laura.
Well, we're thrilled. There's a lot that we can really dive into here based on your background. So if you wouldn't mind giving our listeners kind of a peek into that background. Do you mind sharing a little bit of your origin story and how you became Dr. Carolyn?
Oh my goodness, my whole origin story, that's going to take a while. You think you have enough time for that?
Start wherever you like, whatever you'd like.
Okay, well, I am a medical doctor, an MD, and I'm board certified in both preventive medicine and in addiction medicine. And I've actually been working in private practice and also in treatment centers for addictions and eating disorders for most of my career. And so that's really been my focus. I developed in 2016 an online program for people with binge eating, emotional eating, and food addiction, which is called the Anchor program. And it's a non-diet approach to those conditions. And that's been kind of my passion, to get women to stop spending all their time and money worrying about their size and the number on the scale, which is, like literally sucking the energy out of our lives. So I've written a number of books. The most recent is the Food Addiction Recovery Workbook. And I also am a contributing author to treating Black women with eating disorders. So I work in that field. And then finally, my most recent career is as a co-founder of the Institute for Anti-Racism and Equity, and we do consulting to help treatment centers and mental health centers do better with diversity and inclusion issues. So,
wow, you sound busy.
You know what? I am busy. I feel like I was, when I was in private practice all the time, that's what I call busy. When I had a full-time private practice 5 days a week, on call every night, on the weekends, this, I have more control over my schedule, so it's a little easier.
Mm-hmm. Well, I lit up when you mentioned the anti-diet, non-diet approach that you take. Obviously kind of been worked through with, I shouldn't say obviously, it's interesting to me having worked with eating disorder patients. Mm-hmm. And I'm just curious, how does non-diet approach go with someone who's struggling actively with an eating disorder? Like, how much of an uphill battle is that? Because as somebody who suffered an eating disorder, if you told me not to diet, I don't know any other way, basically.
Yeah, right. Well, the diet is the part of the problem with eating disorders, in terms of that diets are often the trigger for an eating disorder, and they're the thing that sustains the eating disorder thinking. So the diet mentality says, oh, if you want to be happy, and now they say, if you want to be healthy, the only way you can do that is to lower that number on the scale. And everybody believes that. It's a bill of goods that we've been sold. Just like in the 1930s and 40s, we were sold a bill of goods by physicians saying that cigarettes were okay to smoke. Physicians said that. Of course, marketing people said that. And they would show pictures of people in white coats, smoking cigarettes. The same thing has happened here. The diet industry is a $65 billion industry. So that's a lot of money that's being spent to convince you and you and you and all the other women that we know that, unless you look like so-and-so or look thinner than you are, then you're not okay. So they're telling us to constantly be dissatisfied with how we look. And that's what we have come to believe. So you have to start with knocking down that notion of dieting is the only way to be healthy or happy. And one of the things that did that for me was Tracy, I can't remember Tracy Mann. Tracy Mann's book, Secrets from the Eating Lab. That book Tracy Mann is a researcher in the field of weight and diets. And she's been researching for decades. And in Minnesota, at the University of Minnesota. And she lays out the case that shows conclusively, in my mind, how the research has assumed that being heavy is a bad thing. So with that assumption, it's biased all the research. And she's gone through and shown you what the true research shows, which is that within a reasonable spectrum, we're not talking about the people on My 600-Pound Life. We're not talking about that. That's a whole different ballgame. But we're talking about people like you, me, people who may be, living in larger bodies, that you don't have to be thin to be healthy. As a matter of fact, being thin, it like health is a U-shaped curve. It's better when it's not so good when you're too thin, and it's not so good when you're super heavy. But within reason, there's no difference between being, 10 pounds overweight or, having a BMI of 30 or 35 versus a BMI of 18.
Right. Yeah. I mean, we see this all the time. Erin and I deal with women like this all the time. Get a lot of these women like, I just want to lose like the last 10 pounds and having a conversation with these women about why it's so hard for our bodies to let go of those last 10 pounds, because they're not metabolically unhealthy pounds.
Yeah.
They're reserve, like from a biochemical standpoint, an evolutionary standpoint, a lot of this makes sense, but I could so see how this notion that there's something about me that's imperfect, and thus I'm imperfect in the minds of probably the client, I guess, based on how they think they're being perceived. Yeah. Right. And all of this comes from a very deep rooted place.
Yeah.
I would love to talk about that.
Yeah. I recently wrote a blog about that, and I actually did a podcast on that whole thing. Why can't I give up these thoughts about, if I just do one last diet, if I just lose 10 more pounds? And it really comes from a deep place of belief, both that is often related to trauma, and also from just a really recognizable and understandable desire to be like everyone else, to be accepted, to be quote unquote normal, and that you can understand from a heartfelt place that, many women who are living in larger bodies have been bullied as children for being larger, or been teased, or been told you can't be on the team because you're too fat, or you're not an athlete because you don't fit the right size. So you can see the wounding in that need. And that's what, so we can either address the symptom of the wound, which is I want to lose weight, or we can address the wounding, which will have a more profound and long lasting impact on the person's life.
Mm. Gosh, I really want to dive into that. And I think one thing that I was thinking of when you were talking is, okay, so this concept of diet culture, which is getting thrown under the bus, rightfully so currently. And I think folks who don't understand diet culture would assume that it means that the culture at large is encouraging you to be in a smaller body. And that is true. But also diet culture is its own little culture where you're celebrated and rewarded for sticking to it. And then when you're not sticking to it, then you're a bad person. Like diet culture is its own little humongous culture, 4 generations deep by my count at this point, that you're stuck in.
Yeah.
You're really, really stuck in that.
So there's the individual, what I call diet mentality. And those are those thoughts that are going on inside of each and every one of us, which is, you know, my thighs are too big. Maybe I need to get on the treadmill more, or do the Stairmaster an hour a day, or I need to go on a cleanse, you know, because now we're all about health. We're not saying we just want to be thin to look good, but now we're saying we want to be thin because we can't be healthy if we're not thin. And that's called healthism. And it's just code for the diet mentality. So there's the diet mentality that's inside of the individual. And then there's the diet culture of our society. And that is a society, if you look, you know, here's where my social justice work comes into play. Because if you look at, you know, from, you know, 19th century on, even earlier, women have been held down by these expectations that they be thin, and thin has been compared to being virtuous and moral and, you know, good and all of that. And that's kind of been inculcated in us from generations. It's sort of like almost like a historical trauma on women, that we've been told that we have to fit in this narrow, very narrow realm of what women can be approved, you know, can get approval for. You know, you have to be a good girl, right? Yeah. You have to be a thin girl. You have to not get angry. You know, don't be too aggressive, because then you're the B word. That's, you know, that's all part of how women have been kept, I don't want to say under men's thumbs, but we know who runs the world. And generally it's not women, except for Angela Merkel, who had her days in the sun. And I was like, oh my gosh, you are such an incredible person. Right. And we're going to miss you a lot, you know, but for the most part, you know, it is the same people who colonized America and kept Black people down are the people who have tried to keep white people down. So you see that in a lot of the politics, and I don't want to get into politics here, but you can see that a lot of the politics that are promoted are ways to keep women from really flying and taking charge, you know?
So I'm really curious about this, the sense of virtuousness about being a good girl and but being thin, because if you really think about things from almost an evolutionary perspective, if you're too thin, you cannot procreate, you can't grow That's babies, right? Yeah. So there's, at some point, there was a divergence of what this really means. And I'm fascinated at what could possibly have been that turning point. I don't know. I don't want to get political either.
You mean like the turning point from when we left our evolutionary design, which is to store fat to keep us safe, and when it shifted to this sort of patriarchal control.
Well, you know, when I look at the history of America, we know that when immigrant women came from Eastern Europe, they were, generally heavier, they were more curvaceous, etc. And then when Black women were brought from Africa, the same was true. Politically, underclass white people, the lower classes were indentured servants from, Eastern Europe, but primarily from Ireland. And they were pretty much the initial slaves, right? But they were paid, as an indentured servant.
Sorta. Yeah.
Yeah. And then when Africans came, obviously, my ancestors were slaves. And so Sabrina String's book, which is Fear of the Black Body, it's a great book to read because she kind of lays this all out. And she talks about how, there was this division being made to split all of the, white indentured servants off from free and enslaved Black people, who actually caused an uprising to fight against the status quo. That was called, I think it was called Bacon's Rebellion. And so the people in power, the colonizers, wanted to split that group. And so they started kind of dehumanizing Black people. And as part of that, saying that Black women's bodies were immoral, sinful. They were essentially calling them sluts. And, and so, and then the opposite of that was white women's bodies who were thinner, more, they were more moral. They were basically good girls who were doing what the men wanted them to do. So that's my understanding of the origin of that. And that's all political and economic, really.
Yeah.
Because slavery was all about making money.
Wow. So we have this sort of moralistic approach to beauty, goodness, virtue that
which has been
sort of
promoted.
Yeah.
And it's been promoted by the churches as well. Mm-hmm. How many diet books do you see that compare being thin with being close to God? Believe me, there are tons. I've seen the covers. I haven't read them, but I had someone on my program who's a scholar in studying religion and, the focus on body image. And it's pretty amazing, how that's been kind of paired together. And it's great. People should be close to God in whatever way they can. But honestly, I don't think God really cares about what size our bodies are. I think he cares about what size our heart is, but that's a different story. That's a whole nother program. Sorry.
That's a whole other.
We definitely don't want to go into religion here. We've already broached the subject.
We want to stick with health, but I mean, there's a lot built in there for all of us from a very young age, and I know you're an expert in, so I really want to dive into the concept of like childhood adversity and trauma and the role that plays in our relationship with food. Most importantly, like the binge eating, emotional eating, food addiction is huge. I think to a certain degree, I don't know. I was going to say to a certain degree, we probably all have a little bit of that in us, just to varying degrees. And so there's a degree to which that's problematic. I mean, we see jokes all the time about how I always have room for chocolate, or I always have room for ice cream, and people's tendency to kind of binge on those types of foods. And, look, we're health coaches. Our program leans into the science a lot, just understanding biochemistry and biology. So there's that side to things, but there's a huge emotional and psychological component to this that I would kind of love to pick your brain about, to be completely honest. I would love to hear what you have to say as an expert in this.
Well, I have a training program for health coaches, and one of the women who went through my training program, she had been a health coach. I think she lives in the East Coast for, I don't know, 10, 15 years. And she herself had struggled with weight and body size issues. And she was one of those who, if I could just lose those last 15 pounds. And when we when we delved into her history, it was pretty clear that she had quite a bit of childhood trauma, and she wasn't aware of that connection. So in terms of her work, when she became aware of that connection, it opens up a whole nother realm for you to work with your clients. And obviously you're not therapists, so
Right.
you can't do the therapy work, but you can certainly educate people about that connection. So what is the connection? Well, the Adverse Childhood Experiences Study, which started in San Diego at Kaiser Permanente and is now being done in conjunction with the Centers for Disease Control, they had 17,000 people in a study. And why this study became important was they started realizing this was a weight loss program. They started realizing that the people who were losing the most weight were the ones who were dropping out of the program. So Dr. Vince Folletti was like, wait a minute, I mean, they're being successful. Why are they quitting? And what he realized was that these were people who had significant trauma. Some of them, one guy had been in Vietnam and had PTSD that was never diagnosed or treated. And he was, 400 pounds or more. And as soon as he would lose weight, he would have this traumatic memories come back. For women, a lot of women have been raped or have experienced child abuse or childhood sexual abuse. Even childhood neglect, which is a big one. Say you have, I see a lot of intergenerational trauma in families where, the grandfather had alcohol use disorder, the father or the mother had alcohol use disorder. And then there's the child who's being neglected because of the parent being impaired, or the parent could be impaired by mental illness even. So there are a lot of people who don't think of that as trauma. But I really love, the definition that Gabor Mate says, that trauma is a loss of an essential part of yourself, a sense of safety, security, trust, or vitality. So anything that affects a child's sense of security, safety, trust, or vitality can be considered traumatic. So if the Adverse Childhood Experiences Study mainly studies a series of, specific events like anyone in your family has been incarcerated, domestic violence in the family, mental illness, substance use disorders, divorce. What are some of the others? I think I've already, childhood sexual abuse, physical abuse, emotional abuse, neglect, physical or emotional, et cetera. So those are the things that they are studying. But then, as we know, there's a whole host of others. Bullying is so huge now. It's just incredible what little girls go through. It's just shocking. And so what they found, though, before I stop rambling on, what they found from the Adverse Childhood Experiences Study is that the more childhood adversity you had, the higher your risk for substance use disorders, suicide attempts, depression, anxiety, and over 40 medical conditions, including, they also looked at obesity, which, we don't say obesity now, but that's what the study studied. And they then also checked out risk for health conditions like heart disease, diabetes, and cancer, stroke. All of those were increased from a history of childhood abuse or neglect or childhood adversity. How do you figure that? Well, they figured it out that it really relates to what happens to the brain of a child who's developing once they've experienced any kind of childhood adversity. It changes the hardwiring, the architecture of the brain. And that's what then causes children to react differently than they would if they hadn't experienced trauma. They may be more sensitive to stress, so they may be more reactive. So if something happens, they can be flooded with feelings, and then they want to numb themselves with food or with the substance. Does that make sense?
It does.
Yes.
It does. it's so interesting to me. You were speaking about that one study where the people who started losing weight would quit the study. That
Yeah.
actually resonated with me because I work with women who want to lose weight. And one of the things that they say is, I always self-sabotage. Like
Mhm.
women will identify as, I'm a person who self-sabotages. I always sabotage myself. As soon as I start feeling good or whatever it is, looking better, whatever they're trying to get out of it, I always screw it up.
But they're not really self-sabotaging because those behaviors developed at a time when they were, traumatized and didn't have access to certain, to the skills that an adult has. So food was the solution to the child's problem. So when you take away that solution, then the child in each of us who's been traumatized, if they haven't been healed, it becomes afraid, feels insecure, threatened, unsafe. Yeah.
Yeah, and that's what resonates. It's like, what are you protecting yourself from, or
Right.
something like that. There's an element of self-protection that's kind of inherent in that behavior pattern.
Absolutely.
So whenever we talk about trauma, whenever I hear folks talk about trauma, I get a little lost because, I reflect back on my childhood. I didn't have neglect or abuse. Not obvious. Maybe there was some less obvious sort of inputs like that were happening. So like these small t traumas, I don't know if that's a disrespectful way of describing them, but like, bullying or the example this isn't probably a trauma, but the example that I used when I was going through my own exploration of my own body image issues, I went back to my earliest memory of somebody commenting on my body. And I was 6 years old and my mom was washing the dishes and she looked out the window and I was carrying water buckets out to the horses anyway. She shouted at the window and said, "You look so cute with your little love handles." So she was not being mean. She just thought I was so adorable. This little kid with a little chubby bum or waist, love handles, carrying these buckets of water. And that was the first time somebody said I was cute because of the way my body looked.
Yeah.
So like, that's not a trauma per se, but it definitely made some kind of a connection in my little kid brain.
Yeah. And that's pretty common that, people initially don't, first of all, realized what traumas they've had because they seem so small. But, you have to recognize that some people are more vulnerable to those kinds of comments than other people. So if you have, if you have eating disorders or addictions in your family, then a comment like that may go into a brain that's already vulnerable. And therefore, it, boom, just triggers. I remember one of my patients with severe anorexia, and her trigger was she was having lunch with her mom and they were having French fries. And she said, "I want to go back and get more fries, Mom." And her mom said, "I think you've had enough calories for one day." And she didn't know what a calorie was, but she decided she remembered thinking, "I'm going to find out what a calorie is, and I'm going to be the best at counting calories. I'll be better than my mom at counting calories." And that's what she did.
Wow.
I just want to say that I feel so sad for the little girls when I hear those stories. I feel so sad for the little girls, but I also have a sense of sadness for the moms. Because I don't think our moms said these things to us to make us feel bad. They were also brainwashed.
Well, that's the thing about intergenerational trauma, and we know that when women have children, women who've had trauma have children, they themselves are just acting from their own trauma responses. And many times they don't even say anything directly to the children. They're just talking about their own bodies. "Oh God, look how big my butt is getting huge," or something like that. And that can then be passed on to the child. Yeah. But I agree with you. I think it's important to realize that this kind of thing can be passed from generation to generation to generation.
So how can a health coach sort of identify that this might be what's going on, other than the fact that it's rampant and it's likely an issue for many of their clients, particularly if they work with women? So, but what type of maybe comments or tendencies or behaviors might a health coach be ding, ding, ding? This is probably indicative of something. And then maybe what questions can they ask to try to, what's the word I'm looking for? I guess create awareness for the client to be like, you know what, there might be something deeper going on here.
Yeah, I don't think it's a good idea for me to give you tips
Okay.
on uncovering trauma, just because sometimes uncovering trauma can be very traumatic if it's done, even when it's done in the right way. You know, I had a woman in my online program, and one of the exercises was just to go back and collect photos of when you were younger. And just collecting those photos led to her, you know, kind of a triggering of her trauma that she had been like, no, I don't want to talk about it. I don't want to talk about it. But when she saw those photos, it just came all up for her. And it was very devastating. So what I suggest is that each person, if you're a health coach, a doctor, a nurse, whatever, educate yourself about these issues. I think the best resources that I've found are on the Centers for Disease Control website. Like if you Google CDC and adverse childhood experiences, they have all the statistics, they have videos, they have, you know, a whole resource list and so on. And once you really understand on a deeper level, you know, what it means, you can take their ACE quiz, you know, just Google ACE quiz, take the quiz for yourself. And so then you can say to people, well, here's what I've learned about, you know, this issue. And when you know, I mean, you already said something, Erin, self-sabotage. When you hear self-sabotage, almost always that's going to be a trauma clue. People who've been on diets most of their lives, the majority of them too have some trauma. And so you're surrounded by it. You just aren't aware because people don't usually go there. They don't want to talk about it. They don't want to think about it, etc. And so I just think it's important for you to do your own work and educate yourself. And that way you have a deeper understanding both of your trauma. Like Erin, you were saying you were doing your own investigation. That's great. And you can also, if someone comes to you and says, well, why do you think I self-sabotage? You can say, well, you know, in my experience and from what I've learned, sometimes that's related to childhood trauma. And from there, then they need to have a therapist who they can work with, you know, obviously.
That was
really, I was going to say that was really more the impetus behind my question, as far as understanding, you know, when in particular, you know what, this is probably a can of worms. As a health coach, I can identify that this could be a roadblock and it's outside of my scope. So that was really the spirit behind that question, but yeah,
and I think that's great to know about that. And when you learn about adverse childhood experiences, then you'll start to see these patterns all over the place. When you see the pattern, then you can point out the pattern. You know, well, hey, I've noticed that, you know, every time you get close here, that things start to fall apart. What are you protecting, do you think? And, you know, I've read about this and I understand that this sometimes is related to childhood trauma.
Yeah, I think my favorite part about what you shared with us is, like, as a health coach, we can learn about everything and anything that's interesting or might become useful to know about in our practice. And we also want to be really careful about staying in our lane. And even just the way you articulated it, this is something we teach in our advanced coaching course. It's about when a client presents with something something like this. As a coach, we can say, would you mind if I shared with you something that I've learned about this? Or if it's all right with you, I have an example from another client, from me, that is kind of similar to what you're experiencing. Then we can share it, ask them how that resonates with them.
Sure.
And if they recognize, like, oh my gosh, you know, now that you mentioned it, this probably is related to some kind of childhood trauma, say, okay, great. Let's get you set up with somebody who can help you work through that. And it's totally within our scope of practice to get the client thinking that way.
Absolutely.
Well,
and that's what I'm saying. You can educate the client about it if you have educated yourself. So it's just like anything else. When I do coaching on anti-racism, people say, well, it's great to know about slavery and it's great to know about, raise awareness. And now what are we going to do about this? Yeah. So you can't do anything unless you really know to the depth of your being what has happened, and how it has affected people. And that just takes some self-reflection rather than going out and coming from your already perspective and trying to help people that you don't understand.
Mm-hmm. Can you speak a little bit to specifically emotional eating? Mm-hmm. And I guess what I mean by that is it's a behavior that a lot of clients declare they have. I'm an emotional, against the identity statement. I'm an emotional eater. Oh, I'm an emotional eater. I eat when I'm emotional. So this is sort of a self-soothing, I guess, practice.
Yeah. I mean, for me, I think emotional eating is a way to tamp down our emotions. Many people that I've worked with living in larger bodies feel that they are, too big emotionally, like they're, even if they're happy, they're too happy. If they're sad, they're too sad. And people have maybe even told them, like you need to get a grip or, tone it down. And so that's one way you can use food. Or sometimes people are flooded with emotions and they feel overwhelmed. Usually in our program, when people start identifying what they're feeling, it's a lot because they've been using food their whole lives to keep from feeling. And so that's another way that people eat emotionally, is to keep their emotions from overwhelming them. So I think it's pretty common. It's a pretty common thing, whether you have binge eating or food addiction, or you're just an emotional eater, that food is used as a way to manage emotions because they've never been able to learn to do that when they were younger.
I get it. I hear it. Just because of the type of woman I tend to work with, that I'm a stress eater. I eat under when I'm under a lot of stress, which I have to imagine is either the same or highly related.
Yeah, exactly. So when you're under stress, what are you feeling? Most people can't answer that question. When you're under stress, where do you feel it in your body? Hardly anyone can tell you. But then when you start breaking it down, well, is your jaw tight or your shoulders tense? Are you feeling butterflies in your stomach? Those are clues to help people really get reconnected with their emotions and with their bodies. Because as you know, the body has everything we need to know. It's the reservoir of all the wisdom we need in our lives, from the hair on the back of your neck standing up when you are in danger, to feeling repulsed by a person you meet for the first time. And yet, particularly as women, we're taught to ignore those body signs. So we need to reconnect with the body. And for people who've been on diets most of their lives, they can feel like their body is their adversary.
Right.
And so and then people come in and say, oh, you have to love your body. You have to have self-love, body positivity. That's great. But I don't think people can go from I hate my body to body positivity. You have to start with, can I just not hate? Can I just not be making hateful statements? Can I be neutral towards my body? And then you gradually can move towards, can I be more positive towards my body? But body reconnection is a important component of learning to manage your emotions.
Gosh, I'm just geeking out on this and taking so many notes. I do think the body positivity space, although in theory it's so nice, it is a leap too far for just about everybody. And it's sort of like how I interpreted what you said was, why don't we start by just not hating it,
Yeah.
Right.
but respecting it or something.
Yeah, something in between. Just give yourself a little bit of a break. One of my patients came up with the statement when she was in my program that you can't hate yourself thin.
No.
I love that statement because that's what people think. Well, if I just keep beating up on myself, I can motivate myself to go to the gym. If I just say, your hips are too big or you're whatever, that will motivate me. And it's exactly the opposite. Like we never take care of things we hate, right?
Good point.
You
That's a
know,
great point.
if you had a dog and you were constantly yelling at your dog, do you think that you'd have a good relationship? No, not really. So, we take care of things that we care about. So how can I move towards caring about my body?
Wow. That's another golden nugget that I
Great
just
read. Yeah. I mean, looking just from hearing what you're saying, I remember growing up, I mean, I love my dad. He was a great dad, but his entire family, and this is what he kind of picked up as a parent, that it's almost as though he thought his role as a parent was to point out all the stuff I was doing wrong,
Right.
trying to motivate me through
Sure.
fear and through negative consequences rather than through positiveness and being there. And I mean, and it's not that he didn't love me.
Right.
He just didn't have any other tool. That was the tool he grew up with. And that's kind of and looking at it now, just after this conversation, an aha moment as to how my own thought process works and why I have to actively stop myself from saying things to my own children. Sometimes I have to filter because it's a knee-jerk reaction based on how I was raised.
Yeah. With my mom, if you brought home an A, she'd say, well, why aren't you on the honor roll? If you've cleaned your room, well, you missed that one spot over there in the corner. You need to get down with the toothbrush and clean that up. Just so it can create that kind of Judge Judy, I used to call it. In my mind, it was like Judge Judy, and I had to like evict Judge Judy from my brain.
Oh, she's a tough lady.
She is a tough lady. So is my mom.
If you think about it, it just continues to promote that no matter what you do, no matter what you achieve, nothing's ever good enough. So you're always sort of perpetually unhappy and always looking for ways to get better or to, it turns you into a people pleaser, which that doesn't really bode well for people health-wise or emotionally either.
Well, I think what it leads to is these unconscious core beliefs that make you think you're not good enough or you're not lovable or you don't deserve things. And I view the unconscious core beliefs like a set of dark glasses, like shades. So when you're a child and you grow up in that, it's kind of like your dad handed you the dark glasses and said, put these on, and you've been wearing them ever since. And so everywhere you look, it's darker than it really is, that other people see it lighter and you see it darker. And, that means in your relationships, at work, in your career, etc. And until you're able to take those dark glasses off, it's really hard to keep convincing yourself when you're wearing the glasses. You keep trying to convince yourself, well, maybe if I just do it this way, or maybe if I turn on more lights in the house, things will be better. Or maybe if I just, I'm optimistic. I had one patient who said, well, I believe in being optimistic. You know what? I believe in optimism too, but not if it's a way to cover over all your negative thoughts, because then it's like a Band-Aid on a gaping wound. It's not going to work. You've got to find ways to take those dark glasses completely off so that you can see the world as it really is.
No big deal.
Well, you know what? It's a process.
Yeah.
And it's kind of like a commitment to yourself that you make, and then you just take steps along the way. You can't do it all at once. No. It's not going to happen.
Well, can you speak to that? I mean, from your clinical experience, as best you can. I mean, how many attempts, like, does it take, you know what I mean? Like, how open are people to exploring some of this emotional these emotional roots? Are they very, very reluctant to even go there?
Yeah, I
Or
think a lot of people are afraid because when you, especially if you've had childhood adversity, just imagine being a child and being, hit or sexually abused or whatever. That is a terrifying experience, right? And so the memory of your trauma lives from the child's viewpoint.
Mm.
So when you as an adult think about going back and dealing with your, not even going back, but dealing with your trauma, what immediately comes up is the terror of your child self. So what I try to help people understand is that, and it's terrifying. It's lives in your body. So
Mhm.
you actually feel those sensations of the sheer terror or the fear or the anger or whatever you experienced. And so what I try to tell people is we don't go back as children, we go back as the adult. And the adult has more skills and can see things differently. But when you do trauma work, it's not uncommon for people to pendulate from their child self to their adult self, child self to their adult self. So that's why it's important for a therapist to be trained in trauma work so that they can point out, wait a minute, hold on, how old are you right now? And if you're in your child self, we need to kind of reassure and support the child and so on. But the bottom line is trauma work is, any kind of personal work is challenging, but it's not as hard as people think. It's not as terrifying or emotionally devastating as people think. And so I think what I try to do is to encourage people that when you do this work, you take it in pieces. Like I'm as old as I am. And like a few years ago, I still had something come up for me that was triggered about something that happened when I was 8 years old.
Mm.
But, I had already dealt with a lot of that. And there was just one little piece left. And so then it was like, okay, well, so I think the other thing that gets people going in the wrong direction is they think that trauma work is a destination and they're going to arrive at some point and all the trauma is going to be gone. So I was on a program recently and a woman said, well, I've been working on this for 10 years. When is it going to be over? And it's like, this is a part of who you are. So what you want to do is to embrace that part of you, because whatever happened to you has made you who you are. And that's not bad. What's a problem is if it made you who you are and you haven't healed, because then you're using these unhealthy behaviors to continue to cope.
Yeah.
So I think if you can overcome those two unrealities, and it's really it's kind of a more of a way of life. Like for me, if something comes up for me and I feel I don't know, right before the pandemic, I had COVID at the beginning of the pandemic. And, I was just really, really sick. And after I was not really, really sick, I still had a lot of emotion, like fear about it. So in my way of life, if I'm experiencing overwhelming fear, and I'm seeing myself like maybe binging or eating more or, whatever my binge watching TV or other things, then I'm going to call my therapist and say, I'm just experiencing this overwhelming fear. I'm not going to keep doing the things that are going to hurt me. So that's what I mean is it's a journey, and your way you run the journey has to be a new lifestyle. So the way I run my journey is when I'm feeling depressed, when I'm feeling fearful, when I'm not coping, I go out and get help. But a lot of people don't feel that they need to do that,
Right. Right. Or what I hear sometimes is I don't need help. There's been a lot of just negative connotation to mental health
Yeah.
We saw this play out with Simone Biles in the Olympics, and you had a huge flood of support, which is fantastic. But then there was a lot of nonsense that
And
really,
Osaka too.
yes,
Yeah.
that really just, I just think we need to kind of reframe mental health, mental illness, and create a sense of safety around people that need help instead of being stigmatized that there's something wrong. Because quite frankly, we all have issues. We all do. We're human.
That's the point. I mean, the statistic is that 1 in 5 have been diagnosed with a mental illness like depression or anxiety. But 5 in 5 of us have had times in our lives where we've experienced depression or anxiety or, sadness or grief. And so that's part of being human, and it shouldn't be a stigma.
Yeah. I've been diving into the work of Dr. Kristen Neff, who's in the self-compassion space.
I like her. Yeah.
Yeah. And one of the tenets of self-compassion is that there is inherent suffering.
Right. That's a Buddhist principle, which is pain is part of the human condition. And I think the part I read is that suffering is when you can't accept that you have pain. So you create suffering. I have an exercise, I work around this. We all have pain, whether it be loss of a loved one, et cetera, et cetera. But then when we don't address the pain, we create these other behaviors that cause suffering, like overeating or using drugs or alcohol or, being in denial, et cetera. That's what causes suffering. Yeah. The pain we can get through if we just acknowledge it and address it.
Yeah. Yeah. And I think just kind of going back to what Laura was saying is that there's maybe this is even more rampant in like for women, but it's like this idea of sucking it up, like just suck it up, pull, bootstrap kind of weird energy and sweeping things under the rug and other such metaphors.
Yeah.
But what you said earlier is we take care of the things we care about. And so I think getting people to self-compassionately recognizing care.
Right.
That's why I've been diving into it. Like I'm certainly not going to step out of my lane as a health coach and start therapyizing people into self-compassion, but I want to understand the principles of self-compassion because nobody has any self-compassion anymore.
Yeah. And I think the fact that we don't have it for ourselves makes it hard for us to have it for other people too. And we're seeing that a lot as well,
Yeah.
So do you address some of the stuff in your Anchor program? Tell us a little bit about that, because I was checking it out online, the Anchor program, and it looks like you have 2 levels of it or 2 different versions of it.
There are 2 levels. Because I'll just tell you, I had a remarkable experience when I practiced in Denver of having the same people in my program for 5 years. I had never really worked with the same people for 5 years in the program. So this was a real eye-opener for me about how long it takes to make permanent change. And in preventive medicine, the studies show that it takes 3 to 5 years to make a permanent lifestyle change. So stopping smoking, changing your eating, changing your exercise, 3 to 5 years. And yet, the diets are for 3 months.
Right.
You can see why that's never going to work. So this is why I developed my program as something that offers long-term support. So the first part of the program is a 12-week intensive. And this is where we get to the root of the problems, like why are you doing the things you're doing, and help people start to learn skills on changing that. And that has an online curriculum and everything. And then we meet on Zoom once a week. And then the second part of the program is a 6-month part where we are helping people build a structure for recovery. Like I was saying to you, my lifestyle is if something goes wrong, I'm going to get therapy. Well, they need to develop a structure on how to manage their emotions, how to have skills to deal with stressful situations and so on, and stay accountable. And that part is we meet every 2 weeks in our group, and they also have an online curriculum. And then we have an alumni group, which meets once a week. So you can see it's decreasing levels of, structure and oversight, but staying in touch and enabling them to continue to work on things that come up, because things come up and they always look so different when they come up. Oh, well, this isn't like that thing I told you about. This is totally different. But then when you really look at it, it is like that thing. It's just because we all have patterns, of behavior.
Mm-hmm. Very cool. Yeah, really nice trajectory, the hands-on at the front. And then it's almost like the way I articulate it to my clients is like, eventually I want to kind of hand off the accountability back to you, but we still need to be in each other's orbits because things will come up.
Exactly. Right? Yeah.
Cool. And you also have a program that trains health professionals?
I do. I have the Anchor training program, and I've trained people around the world, England and the US and Canada. Yeah. So I really love working with people who want to learn this approach, because I think it just magnifies my ability to help people.
Is there any prerequisites for that? If anybody listening wants to learn your methods?
Yeah, it has to be somebody who's already, has a professional background in this, whether they be a health coach or therapist, or, someone who's, in England, they have a different category that they use for health coaches, but they have people who work for the National Health Service who work with people to help them lose weight, for example. And so just if you have to be in the industry, not just a high school graduate. So.
Gotcha. Wow,
yeah, no, what a great resource. And I think the longer people are in this business as health coaches, and I know Erin and I realized that the longer we're in this, the benefit of what we do goes far beyond food and exercise and all these other things that, Erin has said this several times. I concur, because I have health coaching sessions where we never even talk about food. We never talk about any of this stuff. We're talking about, whatever it is that's come up for them that has, to kind of use your term, these feelings in my body that don't feel great right now. But, a lot of this emotion is the precursor to what's causing them to make the choices that brought them to me in the first place.
Right, exactly. So working on that deeper level will give you more success.
So I'm not a therapist, but I can listen.
Yeah, absolutely.
I can ask questions and I can listen, and then the aha moment goes off, and it gives them the space to not let it go. And that's probably not the right term, but to shine a little bit of a light on it and feel comfortable talking about it with somebody, to have a safe space to talk about it with somebody, so that this person can then see, wow, that was really deep. I wasn't expecting to go there. Yeah. And then, gee, maybe you really should, I'm happy to listen. But that's really all I can do really as a health coach. I don't have training in this. I don't have experience in helping you through this. Maybe this might be an opportunity for us to talk about finding somebody else as well. So, and it sounds to me like your training program can help coaches have that conversation.
Yeah, absolutely. That's the feedback I've gotten anyway. Yeah.
Awesome. Where can people find it?
It should be on my website, CarolynRossMD.com. We have a book sweepstakes going on where I'm giving away free copies of the Food Addiction Recovery Workbook. That's on the website as well. And there's a link to the program, to my podcast, and also you can contact me through my website.
Wonderful. What a wonderful conversation. I learned so much. I'm going to dig into all the resources that you shared.
Yeah. Very much.
Thank you for educating us, Dr.
Oh, you're very welcome. It's been a pleasure to be on your show.
Thank you so much.
This podcast was brought to you by Primal Health Coach Institute. To learn more about how to become a successful health coach, get in touch with us by visiting primalhealthcoach.com/call. Or if you're already a successful health coach, practitioner, influencer, or thought leader with a thriving business and an interesting story, we'd love to hear from you. Connect with us at hello@primalhealthcoach.com and let us know why we need to interview you for Health Coach Radio. Thanks for listening.
Well, if you've been listening at Health Coach Radio, you'll know that we're all about raising the voices of practicing health, fitness, and nutrition coaches, but most importantly, helping to further legitimize this exploding industry. Erin and I have disclosed often that we're on the faculty of the Primal Health Coach Institute, founded by none other than the health and wellness legend Mark Sisson. And we've interviewed dozens of guests from just about every different health coaching program you can think of, and who practice in just about any conceivable way you can think of. But our allegiance is to the health coaching industry in its totality, first and foremost. It's our desire to continuously and unapologetically lift and promote this industry that nudged us to create this podcast for you in the first place. It's this same yearning that encouraged us to take the educational offering at our health coaching school to the next level. We are so proud to offer the Primal Health Coach Level 2 certification course, which, when combined with our primary course, the Primal Health Coach certification course, not only satisfies the educational requirements to sit for the board exam, but is specifically designed to teach advanced coaching mastery. You will work closely with a small class of peers through this 12-week, very intensive, live online classroom experience to learn how to execute a coaching relationship that is truly transformational. You'll learn and practice how to ask powerful questions, what it means to hold space for your clients, but most importantly, how to actually do it. You'll learn about the craft of motivational interviewing and the nuances of habit change, goal setting, and accountability, and how to nurture your client's own inner knowing, their intuition, and their own self-efficacy, so that they will graduate from your care a truly transformed person. You want a big, successful, powerful coaching practice. And maybe you're devouring our episodes looking for the silver bullet that's going to launch your business into the upper echelons. We've said it a million times and we'll say it again. Your coaching skills are what will make or break you and set you apart for success in this field. So if you're looking to level up your coaching skills and maybe dial up your credential and become a board-eligible health coach, look no further. You can learn more about PHCI's Level 2 program at primalhealthcoach.com/Level 2. But if you would value talking to a real person about your path to being a masterful coach and perhaps a board certified coach, book some time with me personally. You can access my calendar at primalhealthcoach.com/call. Or just call me. You can reach me at 844-307-7662. Thank you for listening to Health Coach Radio, and I hope I get to talk to you soon.